Good afternoon. Welcome to today's Grand Rounds. Please remember to fill out your attendance record, and also please remember to fill out the program evaluation. And if you could give us any ideas in regards to future topics or future speakers, the CME committee would appreciate that. Today I have the pleasure of introducing Dr. Mike Kitchell. Dr. Kitchell actually wears several hats. He's a board-certified neurologist. He's the medical director of the rehab unit here at Mary Greeley Medical Center. He's also past president of the Iowa Medical Society. Today he's here to give us some information in regards to blue zones, and please join me in welcoming Dr. Kitchell.
Thanks. I'm sure all of you are wondering, what does a neurologist who specializes in rehabilitation have to do with the blue zones? Well, it's because I think it's such an important topic. We do know that the actions that we do lead to consequences sometime, whether it's cigarette smoking or diabetes. We have to remember that what we do or don't do is going to result in either better or worse health. So the Center for Medicare Services has actually outlined 3 major healthcare goals, and I've talked about this before with some of my other lectures, but I just want to go over them again. It's better healthcare quality. That is, we healthcare professionals are going to try to give better care to our patients, but there is also the population. It's also the community that we live in, that we have a goal of having better health for the community, for the population that we serve. And then I think, as you've probably heard me talk about the costs in healthcare, this is a national problem because we either pay in taxes or in insurance premiums for the illnesses of other people. And so when someone has a hospitalization, and if you recall, the 5% of the most expensive hospitalizations in the country, that is 1 out of 20 people, the average cost of that one hospitalization in this country is $191,000. So if we can prevent a diabetic patient from coming into the hospital with some major complications, we can actually show that there's quite a bit of savings by keeping people healthy. So the new payment reform models, including the accountable care organizations, all emphasize keeping people healthy and out of the hospital. The focus of these new payment reform models is to look at those really expensive patients, the sickest of the sick, and try to keep them from having more avoidable complications or problems, and keeping those chronic diseases from getting worse over the years and costing us lots and lots of money. And these accountable care organizations actually now are putting the physicians and the hospitals at risk. That is, if the hospital and the physicians have a budget and they go over that budget because the patients were sicker or more people got sicker, those physicians and hospitals in these accountable care organizations will be at risk of paying back some of the money that they received because their patients were in worse health and they were spending more of those healthcare dollars. So again, the emphasis is on preventing illnesses and complications and keeping people healthy. So how can we do these things? How can we keep people healthier? How can we avoid or prevent other diseases that are costly? One good example is just being overweight or obese. Those patients cost an extra $120 billion a year because of their problems that go along with those diseases, and that actually works out the math to being $1,700 per patient per year. If you are obese, you're more likely to have diabetes, heart disease, and et cetera, et cetera. So the cost of this is getting incredibly expensive. Now, various different researchers have shown that what you do is going to make a difference, whether you smoke or not, whether you're overweight, whether you exercise, the actions or lack of actions that you do can either add 12 years to your life or maybe even subtract 12. Obviously, for those people that are drug addicts and overdosing on drugs, it could end their lives obviously more than 12 years early. The leading cause of death between the age 20 and 29 is now drug overdosages, and most of these are not methamphetamine, they are prescription drug overdoses. So this illness is sometimes very obviously self-caused. So we can talk about healthy behaviors and unhealthy behaviors, and those things that I mentioned, smoking, drugs, alcohol, are pretty obvious. But what else can we do? What else can we do here in our community to improve the health of the community and the population? So over the years, public health researchers have found that your genetic predisposition probably accounts for 1/4 to 30% of your longevity, your health over the years. Obviously, there are genetic diseases that impact people. And there is probably a hereditary predisposition, obviously, to be obese. But again, you can see that those other factors are pretty important. Please notice the one factor that we take great pride in, that is better health care here in Iowa. Remember, we're number 2 rated as far as health care for adults, and we're number 1 rated for children in Iowa for health care quality. But since it's only about 10% of what impacts people's health and longevity, it's actually quite a bit smaller than some of these other things. The social environment, the physical environment. There have been studies showing air pollution actually has a direct relationship to many different diseases, not just pulmonary problems. So in studying community or population health, we look at the health outcomes and the distribution of diseases and problems in the community, the determinants that influence the distribution of outcomes. For example, if there's a lot of poverty, there are certain diseases that are more characteristic. If there's a lot of cigarette smoking, if there's a lot of crime, obviously those affect a lot of the public health too. So policies and interventions at individual and community levels are what we're going to talk about today. And I'm going to, in particular, talk about the blue zones. There are some national initiatives, though, to improve population and community health. These are just a few of the national examples of that. The whole blue zone concept grew out of the initiative to make Iowa the healthiest state. According to the Gallup Healthways poll, we're actually only 16th in the country. Where our health was actually lowest was in the workplace environment. There was more stress in the workplace in a lot of our Iowa communities. They've rated this not just by states, but by communities. So the goal by the governor has been to be number 1 in this Gallup Healthways poll by 2016. So we've got to get busy pretty quickly here to do that. And we need both individuals, families, businesses, organizations, charitable and faith-based organizations, and the public sector. The Ames mayor and the city employees have been backing this Blue Zones initiative here too. So this is to promote community-based efforts to improve health. And now a lot of people will say, well, hey, Blue Zones is just the latest fad. There are a lot of fads that have come and gone, I think this is one, though, that is worthy of us sticking with it because it has a much broader range of action, and it's also quite clearly based on science, on evidence. And these are part of what the state is doing in the Healthiest State Initiative. There's actually a push for gardening, for biking. There's the Michelle Obama national push to get kids more in motion, to do more physical activity. There was a day on the Hill in Des Moines where people were invited to come to the State House and to participate in some education for health. How many of you participated in the state walk? It was like October last year. How many walked around? Gosh, I'm sure there were a lot of you who did that. Mary Greeley had a whole bunch of probably 100, 120 people walking around. It was just a 20-minute walk over the noon hour. But about, 9 or 10% of the Iowans actually participated at the same time with the state walk about last October. Laugh Out Loud Day is also another initiative. And then finally, as I'll be talking more about the Blue Zones Project here today. The Blue Zones Project has nothing to do with Blue Cross Blue Shield. You may have heard that the Blue Zones are, the project is sponsored here in Iowa by Healthways, and Healthways is in turn sponsored by the Blues, the Blue Cross Blue Shield of Iowa. So there is some sponsorship and some money to help bring out education and some transformation. So the Blue Zones really have nothing to do with Blue Cross Blue Shield other than in Iowa they are funding some of the educational efforts for that. The Blue Zones actually come directly from Dan Buettner, who was a researcher who studied areas in the world that had longevity and healthier living. And these were the 5 areas: Costa Rica, Sardinia, Italy, Loma Linda, California. Apparently, the Story City Norwegians didn't quite fit the bill, but Loma Linda did. Icaria, Greece, and Okinawa, Japan were the 5 areas that Dan Buettner studied because they have a huge number of centenarians and they have a very long life for most of their population. So he studied those characteristics, and over a series of reports in National Geographic, and I was actually able to see one of his lectures where he had some videos. It was really impressive. I hope that we could pass those along. So again, what Buettner did with his research in the early 2000 era was that he found that there were some lifestyle habits that these communities shared. Despite the fact that they were all over different parts of the world, they had really 9 major themes or habits that these communities shared in common. And so this was the push behind the Blue Zones Project, that if we took those same lessons from these areas of the world and we applied them to our own population, we could possibly have that same type of improvement in the health and longevity of our population. So I'm just going to go through these now. If you have some questions as I go along, you can interrupt me, but I would certainly encourage you to get on the Blue Zones website and learn more about it yourself. How many of you have actually already signed up for the Blue Zones Project? Great, so I'd say maybe half or 60%, so that's good. Dr. Scherholz, who will talk a little bit at the end here, has told us that it's really important to have as many people sign up as possible, because the more people we sign up from our community, the more likely we will get some of that grant money to get these educators and people to help transform the community actually come to our community to help make some of these changes in our lives and behaviors. So anyway, the first principle is pretty obvious. It's what I tell my patients every day, whether they have Parkinson's disease or a stroke or rehab: get out there and move. And it doesn't have to be working on a fitness machine in a fitness club. It could be just simply walking, doing housework, gardening, taking the stairs instead of the elevator, biking, and so on. How many of you have gone to the Jordan Creek Mall? Have you ever gone to the Jordan Creek Mall? Okay. How many of you ever walked to the Jordan Creek Mall from someplace in Des Moines? Gosh. Okay, how many of you have walked around Des Moines, the city of Des Moines, to various stores and restaurants and theaters? How many of you actually walked around downtown Des Moines? Okay, well, I'm sure when you got to Jordan Creek Mall, you probably walked in the mall, but it's not exactly a walkable type of place until you get there. It's surrounded by this moat of parking lots and streets and highways, and there would never be a child who would even bike there because it was just so automobile-centric. And so some of our suburbs have basically been built upon the idea that everybody has their own personal vehicle and doesn't expend any energy until they actually get out of the car and then have to walk through the parking lot to the mall. But again, that's what the Blue Zones Project is about, is to make these communities more walkable, to encourage people to do what comes naturally, and that means exercise as part of their natural daily routines. So the second thing is know your purpose. Why do you get up in the morning? Most of these people in these Blue Zones communities had some purpose in their lives, and they would articulate their values, their passions, their gifts, their talents, and then they acted upon those. They had a reason to keep on doing what they were doing. So the recommendation is to do those assessments of your own reasons for getting up in the morning and the purpose of what you're doing, and hopefully add meaning to your life and incorporate it into your daily routine. And then I think we all tell our patients this. We do know as healthcare professionals, it's pretty common to have our patients come to us because they're under stress. And so these communities in the Blue Zones either would pray, meditate, think about their ancestors or their past. And actually some of these, like in Greece and Italy, had maps as part of their daily routine as well. So whether it's yoga or whether it's some other sort of time that you spend either praying, meditating, thinking, again, make it part of your daily routine. And this is a principle I think all of us could probably do pretty easily. They actually said that in the Okinawan culture that they would stop eating when they were 80% full. That is, they didn't stuff themselves, and they had reduced portions and sizes, and they stopped eating when they got to feeling 80% full. And a lot of the Blue Zones areas, they actually had their smallest meal in the evening. Their larger meals were breakfast or midday meals. So the problem, of course, with a lot of Americans' diet is that it's not only high fat, it's got plenty of meat products in it. And they found that even though many of these communities ate meat occasionally, like 2 days out of the week, they did not have meat on a regular basis. And when they did, it was the portion about the size of a cell phone or a deck of cards. And their diet involved a lot of fresh fruits, vegetables, numerous types of beans, nuts, and like I say, a plant-based diet. And I had one person reacted to the one of these 9 principles by saying, well, why don't we just give everybody grape juice? Why do we want to promote alcohol usage? And the point is, we just don't know, because the people in Okinawa and Sardinia didn't drink grape juice. They drank wine. And so it perhaps is just as good, but we really don't know. And so if you want to drink grape juice, that's fine. But if you want to do what has been shown to be helpful, you would drink no more than 1 glass a day for women of wine, and no more than 2 per day for men. There's always a question too, well, what about beer? What about other alcohol? Is it as effective or as helpful? We really don't know that. You know, the Germans and some of the other Europeans do drink a lot of beer, but again, we don't have any area in Germany that has this type of blue zone. So again, sure, beer could be effective. Again, we just don't have a lot of evidence. We do know that too much wine or too much alcohol is harmful, but this much is good. And the social circles are important. The Okinawans actually had 5 friends that were childhood friends that they had in what was called a moai, and they actually had these friends as lifelong friends. Even in their 90s, they supported each other. So they grew up as children, and they continued to be friends throughout their entire lifetime. So that sort of social circle is really important. All of these communities had friends that were lifelong friends that supported them even when they were 60, 70, 80 years of age. And as we all know, sometimes when people get to be 70 or 80, they get dumped into a nursing home, and that's about it for them. We do know that some behaviors are contagious. For example, I think in healthcare, one of the contagious behaviors we have is complaining. We're all negative. We always complain a lot. And that can be definitely very contagious. Just like if you find someone who smokes, their friends usually smoke as well. And those of us who don't smoke generally stay away from those folks. Even obesity, a lot of friends also have the same sort of eating habits and so on. So behaviors can be contagious, and the rule is, so pick the right friends. Now, the other thing that was really frequent in this, Dan Buettner found that out of 263 centenarians, he found that 258 out of 263 belonged to faith-based communities that felt that that was a very important part of their lives. And so he actually found that if you attended a service, a faith-based service, 4 times a month, he could actually calculate that that would add 4+ years to your life. So again, that wasn't any particular religion. That seemed to be any particular religion. If you attended that service and you were part of that faith-based community, it would add 4+ years of living. And of course, this is, again, pretty obvious, but again, the blue zones are not, this is why I think the blue zones are not just a fad of an exercise or a diet or something, that this is actually changing your social habits, your social behaviors, and of course, the family ties are important. Again, in these communities, Buettner found that if your aging parents or grandparents were around, that again added to your longevity. That is your longevity if your parents were around, as well as their longevity. And so he again could calculate that just by this particular principle, that would add approximately 3 years to your life expectancy. So these blue zones principles are not just exercise, diet, keeping your weight down, but a lot of these were social type of situations or a social environment. Now, if you go to the Blue Zones website, you can get a lot more information. You can go pretty deeply into this. There's a vitality survey that I took, and so now I'm getting daily coaching tips, not from Fred Hoiberg, but from the vitality coach. And it's basically based on a survey that I took and that you could take, and you'll find out that there's some helpful things for you to do. I also took a survey, the same type of vitality survey, and I found out that my age is actually 10.5 years younger than my real age. So, but I'm not 12 years younger, so I've still got a ways to go here. And then, of course, you'll hear about these events, and that includes that walk that is a simultaneous walk, statewide walk. I think it's going to be in October again this year, and it'll probably be over the noon hour. So hopefully we'll get about 20% of the population in Iowa all walking at the same time. So here are some of the major areas of focus for the Blue Zones too, not just these principles that everybody can do individually, but how can we change the community? And those are to encourage not the parking lot moats like the Jordan Creek Mall, but actually some walking paths, some trails, some bike paths, and so on, so people can get active and get outside. Obviously, volunteering for various activities can give you a purpose. I'm just continually impressed with the volunteers here at Mary Greeley, how committed these people are to participating and helping. And then, of course, with healthier workplaces, like I say, with that Gallup Healthways poll, Iowa's lowest scores were in their workplaces where people felt stressed. I think we feel some of that in our healthcare workplaces too, that we're expected to do more, produce more in a shorter period of time. And then when we get these electronic medical records that help in some ways, they also are a burden in some other ways. But again, if we can find a way to reduce stress in the workplace, that could be a big factor for us to work on. And then the easy choices, for example, food and activity, if we make it easier to walk rather than always have that barrier of I got to take the car to the store, that could be something that would be easier to do. And if you went to a restaurant where they had more healthy choices, again, that would be easier for you to do. And again, social choices for lifestyle, the right tribe. Albert Lee, Minnesota actually did this Blue Zones project in 2009, and they actually had a lot of social events and little groups of friends who would get together to do their exercises or their social events. And so that was, again, part of these group activities for moving naturally. So as I was saying, Albert Lee went through this project in 2009. They actually had help from a grant that helped their community to do all of these transformations, and 27% of their citizens participated in the Blue Zones project. And their city employees all participated, and they had a 49% reduction in healthcare costs the first year. So people, amazingly, when they decided to get healthy, they really did reduce healthcare costs. I don't know that that was sustained, but again, it was an impressive thing. And then a 21% drop in absenteeism. And then even in that period of time, they could show that there was an increase in life expectancy. So in Iowa, we had this challenge that was announced last winter, and Ames made a good effort. John Scherholtz and Elaine Heber have been the leaders in this Blue Zones project effort for Ames, and the mayor, Ann Campbell, has been very supportive. The city staff has been very supportive. There's a lot that Ames is still doing, We do, we were not chosen in the 4 communities. They were Spencer, Spencer, Cedar Falls, Waterloo, and Decorah that were Mason City. Those 4 cities, all north of us, were chosen for the first round, but we still have a chance in the second round, which will be this fall, and then they will be announced again in January. So again, we need your help to sign up. John can talk in just a little bit about we still need more percentage of our community to be participating with the Blue Zones. So, as I said, John has been busy. Elaine Heber, Shelley Jakey, the Mayor Ann Campbell have been out and trying to get more support for this. The latest activity is on focus groups with our major employers to do some workplace wellness, and that's going to be scheduled shortly here in July. And there is actually a certification for workplace wellness that will be measured as of January 2013. There's going to be a healthcare providers educational forum for community stakeholders as well in this summer shortly. There will be, like I say, a chance for Ames to have an addendum for the application to receive the grant, again, to get these dollars to help with educating and transforming the community. And so again, what we'd like you to do is sign up, and you can get all this information through the Blue Zones website. And again, as I said, there's an official visit in October. And then the second round is January 2013. Now, even if we don't get this grant, the City of Ames is committed to trying to push through some of these changes. And so what that would mean would be to educate the community to, again, promote this type of healthy behavior, to help businesses improve their work patterns to reduce the workplace stress and promote wellness. We don't always know exactly what the best investment for wellness programs is. In fact, at McFarland Clinic, we're looking at what should we do for our physicians and staff to improve their overall health and well-being. In schools, though, it's again not just improving wellness, but changing some menu choices at the schools, what's available for these kids, and if they get used to eating those fast food, French fries, and so on, they might be getting some bad eating patterns. I think most of you saw the announcement that Mary Greeley had discontinued their deep fat fryer, and so now the fries are actually baked. And so Mary Greeley has already initiated some of those changes in the menu choices. This also would involve getting some restaurant owners to put more healthy choices on their menu, maybe downsizing some of their meal sizes and putting more nutritional information so people could actually read what the fat content is, what the total calories are, and so on when they go to a restaurant. And some restaurants have found that that's a way to get more business. So it's something that is more than doable. So what can we do as physicians and healthcare professionals? I think we need to lead. I think we need to show that this is something that's good for the health of everyone. And if in the future we as physicians and healthcare professionals, if we're responsible for those costs of our patients getting sicker, like I say, just one hospitalization for the 5% of the sickest people, $191,000. If we can reduce those costs, we'll be more successful in the future as well. So as I said, that three-part aim of higher quality care, better population health, and lower costs, that's all part of this whole effort that the Blue Zones are doing. So I'm going to let John talk a little bit more about some of the issues that he's seeing with the Blue Zones project. What percentage of the population do we have that's actually signed up right now, John?
We have 7. Can you hear me? We had 17% of Ames citizens sign up for the Blue Zones pledge, and we had sort of hoped to get 20 to 25. Mason City had 18, Cedar Falls had 20, Spencer had 38%. So those three communities that were ahead of us had significantly more pledges. Waterloo had 5%. So there was some politics. We have this. We have an extremely robust board for the Blue Zones in Ames, and university support, and one of the things was we didn't have good collaboration with Iowa State, which was totally a misunderstanding on the part of the Blue Zones. But the bottom line in this whole thing is that Wellmark and Healthways have committed $5 million over the next 5 years for healthy initiatives. They're not going to send money to the community. They're going to send a restaurant expert in, and it's been shown in some places that it's been done when the restaurant people come in and put fruit or vegetables as their first side as opposed to French fries. They don't hurt their margins. In fact, they've helped their margins, and there have been an incremental change in healthy initiatives for that. So anyway, our group has not dealt well with rejection from the Blue Zones group with this, and we're still working. As Mike said, there will be in January another selection of communities that do that. We are working hard to be one of those communities when that happens in order to tap into the resources. There's a Blue Zones Institute that the communities that were selected will send people to in June, and we'll be able to have 2 seats in that institute for 2 days, and so they will bring back information for us, and we plan to continue to do this. So if you live, work, or go to school at Ames, we would appreciate your support for this. And it's actually, there's a AmesBlueZonesProject.com is easier to access than the BlueZonesProject.com. We just put Ames in front of that. So I would encourage you to do that, and we will continue to work to make this happen.
So, John, I was interested to hear that Waterloo only had 5% of their population sign up, and we've had 17%. So I don't understand that selection process. You know, when Iowa was in the running for some grant money from CMS, a lot of primary care physicians in Iowa, Don Skinner, Dave Carlisle, were active and tried to get these grants for patient-centered medical homes in Iowa. But Center for Medicare Services said, well, despite the fact you had a really good application and you really got good organization for a patient-centered medical home model in Iowa, we didn't choose Iowa because we wouldn't have as big a bang for the buck. In these other states where they have low quality care, they would have a much better improvement in health status. So I don't know if that's the same reason that we weren't chosen for the Blue Zones, but I'm sure there's probably a little bit of politics in there too. So again, we're going to keep pushing for trying to get the grant when it comes up in October and then announced in January. But again, it's I think it's just a commitment for the community to have better health of our population. You know, at the free medical clinic, that's where we see the people who fall through the cracks too. And if you can reach some of those folks to help themselves as well, it really, if you don't know how many people come to the free medical clinic, it's a lot of folks that need help, and hopefully we can offer some more help to the community through the Blue Zones. So please sign up. Are there questions? I'm sure there are probably some questions too.
Sign up for Blue Zone?
Children.
Okay, children 13 or over can sign up for the Blue Zones. And John, the Iowa State students, they're gone for the summer. What was the percentage that they had sign up for the Iowa State students?
We didn't have that broken out. As it turns out, something about their information included the students in the numerator but not in the denominator. So the students actually helped us because they didn't have them in our database. But we don't know what they were.
Yeah, we were hoping to have a little bit more support from the Ames Tribune too, but that's been a little bit hard to come by. I've written an article, John and Elaine Heber wrote an article too, but we've just not been too enthusiastically received by the Ames Tribune. Apparently they had some concerns that this was going to help out the Blue Cross Blue Shield company because it would help them to utilize some of their dollars, that the new ACA law wanted to make sure that they had a higher percentage that was given back to the providers rather than profits of the administration. And so the concern was that this was just going to be a publicity stunt for the Blues, but it has nothing to do with Blue Cross Blue Shield. As I said, this actually, if it's going to keep patients out of the hospital, then yes, the Blue Cross Blue Shield will pay less to the doctors in the hospitals, but also those people didn't have to be in the hospital, and that's a good thing, I would think. Okay, so you're all going to sign up for the Blue Zones. All right, thank you.